Hello everyone, welcome to my channel. In this video I'll be describing in detail about the chest pain, the different causes of chest pain, differentiate between cardiac and non-cardiac causes, and in detail about the cardiac causes of chest pain. So let us start the video. The acute chest pain of non-traumatic origin is common reason for the presentation to the physician's office and the emergency department. Acute chest pain depends upon different etiologies, so it is very important to have a goal-oriented management. When we talk about the statistics of chest pain, around 5.4% of the emergency visit is due to chest pain, and around 8 to 10 million people in US complain of chest pain annually. The most common fear of the patient with acute chest pain is for having myocardial infarction. Also, chest pain is one of the most common reasons for being referred to a cardiologist, and the most common age of presentation is middle-aged or the older adults. Talking about the symptom of chest pain, different patients might have different sensations depending upon the triggering factor. Grossly, we divide the chest pain into cardiac and the non-cardiac related chest pain. The cardiac related chest pain might present with pressure, tightening, fullness, burning sensation at the middle of the chest. That might radiate to the back, neck, jaw, shoulder, or the arms. The pain might last more than few minutes and worsens with activity and varies with intensity. There might be associated symptoms such as shortness of breath, cold sweats, dizziness or weakness, and nausea or vomiting. It is difficult to distinguish the cardiac and non-cardiac causes of chest pain, so we need to visit the hospital if you have any kind of symptom. So it is better to be safe than say sorry later on. The symptom of chest pain might be due to problem with heart, lung, esophagus, muscle, ribs, or the nerves. The chest pain can be life-threatening as well, so it is advisable to visit the hospital as soon as possible. There are different causes of the chest pain. So here I enlist the cardiac and the non-cardiac causes. The cardiac causes could be myocardial infarction, coronary artery disease, myocarditis, pericarditis, hypertrophic cardiomyopathy, mitral valve prolapse, coronary artery dissection, and so forth. The non-cardiac causes of chest pain could be gastroesophageal reflux disease, esophageal spasm, peptic ulcer, pancreatitis, biliary colic, pulmonary embolism, pneumonia, pneumothorax, chest wall syndromes, nerve root compression, or panic disorders or depression. Let us talk in detail about the cardiac causes. First, the myocardial infarction. Myocardial infarction might occur when a portion of the heart is deprived of oxygen due to the blockade of coronary arteries. There might be irreversible damage that begins within 30 minutes of blockade. When we talk about the symptoms of heart attack, it can vary. Sometimes some can occur suddenly, sometimes some signs weeks or days prior could be there. Early sign could be recurrent chest pain or pressure which are triggered by the exertion. When we talk about the symptom of the chest pain in case of myocardial infarction, the chest pain could be crushing type of pain mainly at the center or the left side of the chest, which might radiate to the neck, back, jaw, or arm. The chest pain is not relieved by rest. When we talk about the treatment, there are different medications to improve the blood flow and to dissolve the clot, and also some surgeries to treat the arteries that are narrowed by atherosclerosis. Now, talking about the coronary artery disease, it is due to the narrowing or blockade of the coronary arteries that is caused by the atherosclerosis. Atherosclerosis is also known as hardening or clogging up of the arteries. It is due to the buildup of the cholesterol and fatty deposits on the inner wall of the arteries that restrict the blood flow to the heart. Without adequate blood flow to the heart is starved of oxygen and the vital nutrients which is needed for it to work properly. If it happens, it can cause chest pain and angina. When one or more coronary arteries are blocked, the heart attack might occur. If chest pain lasts more than 5 minutes, call emergency vehicle or NOMA immediately. So there are different risk factors. The age for men more than 45 years, or women for more than 55 years or older, using of tobacco, high blood pressure, high cholesterol or triglyceride, obesity, diabetes, metabolic syndrome, family history, lack of physical activity, stress, illicit drug use, or autoimmune disorders can be there. The most important preventive strategy is lifestyle modifications, which constitute of the healthy eating, not smoking, exercising regularly, managing of stress, and treatment of conditions such as diabetes, hypertension, or high cholesterol. Myocarditis can affect the heart muscle and the heart's electrical system. The myocarditis is the inflammation of the heart muscle. The different symptoms could be chest pain along with fever, fatigue, palpitation, and shortness of breath. It can reduce the ability of the heart to pump and causes repeat or abnormal heart rhythms known as arrhythmia. There are different causes for myocarditis. Most important one is the viral infection. Others could be use of different kinds of drugs. The treatment depends upon the cause. The complications after myocarditis could be heart attack or stroke, heart failure, sudden cardiac death. The preventive strategy is to avoid people with flu or viral illnesses, minimizing the exposure to different types of ticks, and getting vaccinated with influenza. Pericarditis is the inflammation of the sac around the heart. Pain is very similar to that of angina. The cause could be viral, bacterial, fungal. Most commonly, pericarditis might occur after heart attack or the heart surgeries. Also, it might occur due to the intake of some medications. There might be a very sharp pain which is steady along the upper neck or the shoulder muscle. Hypertrophic cardiomyopathy is a genetic disease where heart muscle grows abnormally thick. The symptoms could be chest pain along with dyspnea with exercise, and the most common cause is due to the blood flow out of the heart. The most common presentation is the athlete who run for a very long distance and collapse suddenly. Talking about the coronary artery dissection, the risk factors could be female, extreme physical exercise, and severe emotional stress, as well as high blood pressure. The coronary artery dissection is due to the tearing up of the arteries that supply the heart. There might be chest pain along with the radiation of the chest pain towards the back, neck, or the jaw. Most common underlying disease that is associated with coronary artery dissection is the hypertension. If you have any signs or symptom of chest pain, do not wait. Please go to the hospital immediately. Proper lifestyle maintenance is important. Eating healthy, exercising regularly. Do not ignore any discomfort in your body and get it checked immediately. This is it for the portion of the chest pain. Do like, share our videos, and subscribe to our channel for more content on the symptoms. Thank you.